Good morning, everyone, and welcome to the February Coffee and Conversation. This is a monthly series jointly hosted by the Carsey School of Public Policy, the New Hampshire Bureau of Education and Training, and the New Hampshire Certified Public Managers Association. This month, we have Dr. Moira from the Office of the Child Advocate, who is going to kind of lead a conversation about the role of the office and what's going on with all that. So, join me in welcoming Dr. O'Neill. Thank you.
Good morning. It's great to be here. I really appreciate the opportunity to speak with folks about the Office of the Child Advocate at this time. I have with me Emily Lawrence, who's the Associate Director and Counsel of the office, and so she can kick in if you have specific questions that I can't answer. I thought I would just do a casual conversation this morning with your coffee. I do not have slides prepared, and I apologize to those folks who are watching on video because you'll just have to look at me for most of the presentation. Hadn't really thought that through. But there's plenty to talk about in terms of our office and in terms of offices like ours as a phenomenon across the country in state government. And I feel like this is an audience that's really interested in state government and how things are operated. So I welcome your questions this morning as we go through, whether it's operations or concept or any of the other sort of topics that come forth about kids in general. So the Office of the Child Advocate here in New Hampshire is an independent agency that oversees the Division of Children, Youth, and Families, which is Juvenile Justice Services and Child Protection Services. We're also mandated to make sure that children's best interests are served. So there's essentially an ombudsman rule. Our statute is written much like an ombudsman statute would be, and there's also a little bit of advocacy in there. Are folks familiar with the role of an ombudsman? Anybody have a question about what an ombudsman is? So just so that we're all on the same page. An ombudsman is a really ancient role, actually. It's been around for a long time. I have documents from very, very early on in ancient Egyptian history where there was an advisor to the governor of Egypt who suggested that to be a good governor, to govern well, there must always be a time and a safe space where constituents can come and bring their complaints or their grievances to leadership. In a non-threatening way, leaders should hear what people's concerns are about government, and so that they can make it better and be responsive. Some people argue the First Amendment, also that idea of being able to express your grievances, that the ombudsman rule is a conduit for that we all should be able to let government know when things aren't going well. So the ombudsman is the person who takes complaints about government. And generally it's it's an independent role, but it's also an impartial role. So all you're doing is looking at what is the person's experience with government services, and how did the government respond to that person? Was it fair? And is there credibility to this complaint, or is there something that we have to fix? Ombudsmen and as the child advocate, we have no enforcement authority. We're just have the capacity to shine light where government isn't acting as it should, and then hopefully people respond to that because we all are committed to operating the way that that law requires and that's most responsive to people. So that's the role. There's in the history of children's ombudsmen or advocates, the first was in Sweden. The Scandinavian countries, Norway also had a very significant role in children's ombudsman work. And now there are an ombudsman-like person at the national level in almost every country around the world, thanks to the Convention on the Rights of the Child, which is the most ratified human rights treaty in the history of human rights treaties, where all of the nations that are part of that community have ratified the Convention on the Rights of the Child, which sets out all of the really necessary rights for children so that they can be not just respected, but situated so that they can grow, develop, become healthy, productive adults. So every nation that's ratified that treaty has this ombudsman role who oversees compliance and encourages and promotes the respect of children's rights. So the United States is the one country that hasn't ratified that treaty, and so we don't have a national level ombudsman, although there have been over the years, particularly in the Nixon administration, when we came very close to having a national ombudsman. But what we do have in the United States, this has been very interesting in the era of small government, is a fast-growing community of independent oversight agencies, either ombudsmen, child advocates, and sometimes children's aides, and sometimes they have different names, but their statutes are all fairly similar. So right now there are about 20 of us across the country, and Vermont is now considering legislation for a child advocate. New York has advocates who are proposing legislation, and there are a couple of other states who are considering it. So it's the fastest growing sector in state government across the country. Really interesting that that's happening at this time, when otherwise we're sort of thinking like, how do we make government smaller? So clearly there is a consensus across the country that children are vulnerable, that they generally don't have a voice, that they're often not on the agenda, and that we need to have some kind of official entity within state government to watch out for them, but also to promote their interests. So it was really exciting that New Hampshire gathered up the support in order to establish this office. So we just passed a 2-year mark that I was in this position. I was sworn in January 30th, 2018. What's also common across states in offices like mine is that they are established in response to some significant tragedy. It's very interesting to look at the cycles in state, particularly in child welfare, where you see a significant budget impact, big cuts in budgets. New Hampshire saw that around 2010, 2011, where lots of services that affected child welfare and juvenile justice were cut. And then you see a terrible tragedy. In New Hampshire, that tragedy was Brianna and Sadie, 2 little girls who were murdered by their parents. And then a big reaction to that, a huge investment in the state budget, and also the establishment of an independent oversight agency. So that's where New Hampshire is, it's where Maine is, it's where Connecticut is. All of those states have established offices in similar reasons. One of the interesting aspects of the establishment of the office in Connecticut, which is now, I want to say, at least 20, 25 years old, was that when the child died in the tragedy that prompted the establishment of that office, they went and looked at, a commission was drawn together to look at the death of that child. And they saw that there were about 20 state agencies that were involved in that child's life. Of those 20 state agencies that were involved in that child's life, none of them had ever spoken to each other. They had no idea what the other was doing. And so it was really key in the development of that office that there would be authority to access records and be able to talk to other people, and in fact bring people to the table to say, we're all working with this one particular child. What are you doing? What are you doing? How can we complement each other in our service to this child and this family? And that's sort of been the impetus for a lot of offices like ours. And that's something that we have tried to embrace in the Office of the Child Advocate here in New Hampshire, is to try to look at who are the players, what do they know, and how can we serve as a form of information to all of them, so that everyone is being able to serve a child and the family in the best way possible. So in order to do that, the authority of the office and the crux and essence of the office is access to information. So the Office of the Child Advocate in New Hampshire has oversight of DCYF, the Division for Children, Youth, and Families. And through that, we also have access to all of their records, all third-party records, any records of reports that go to the courts. So we're able to access all that information in order to get a whole picture of what's happening in the child's case or children's cases. And what we do with that information, we may advocate for an individual child, but we'll also start to watch that information from case to case and look for trends, because what we're really interested in is not, we certainly want to help an individual child, but that doesn't fix systems. What will fix systems is to understand where there are weaknesses or opportunities to strengthen systems. So we look at many cases across the board. And so, short question.
In working with DCYF, do you also work with the schools for that child to get information from the schools?
So that's a great question, and what that points out, and it's so interesting that you jumped right into that, because that speaks to the fact that there's no child involved with one service who isn't involved in others. And certainly education is the bulk of services for children, because that's where children spend all their waking hours, is in schools. And in New Hampshire in particular, access to services is always almost exclusively through schools, certainly for developmental disability services and other counseling, all those sorts of things. So we don't have oversight of educational services. And so we don't have direct access unless they're third-party records that DCYF is also accessing. There is a bill before the legislature right now, Senate Bill 295 by Senator Carsey proposed, that would expand our services so that we can access more information for children. Schools are definitely the entry point to juvenile justice systems. So understanding what's happening at school, what services are available, will help us to figure out some remedies that will prevent. So while it's really important that we are watching what child welfare and juvenile justice are doing, it's more important that we keep kids out of those systems. The research is very, very clear about the trajectory of success in a child's life. Just having an exposure to juvenile justice or child protection services is an adverse childhood experience. And it's going to interfere with that child's trajectory to success.
I'm the welfare administrator for Exeter, and I actually find that there are children who are approaching their guidance counselors or nurses within the school, and those administrators are calling me, and that's how I'm finding out about families that need assistance, is through the children, through their schools.
Yeah.
So I believe that the bill put forward for your access to the school records would be very important.
Yeah, thank you for that. I agree with that, because there isn't really one broad view right now. There isn't someone who is standing watching all of those domains interact with each other. While at the same time, certainly in the Department of Health and Human Services, that is a really big agency that has many other agencies within it. And the whole point of that agency being so large is integration. So you have child welfare, you have juvenile justice, you have public health, you have developmental disabilities. So all of those folks should be able to really work with each other. Unfortunately, they don't always, and that's a big effort of the department right now, is to try to smooth out those lines of communication and projects. And there are some now where you can see Department of Health and Human Services is reaching over to education as well. The Office of Student Wellness is trying to integrate more with that idea. So it makes sense that there would be some kind of an oversight layer. And some people sort of object to the thought of oversight. We're not actually police. We're people who are looking at how the system is functioning. We have that one viewpoint. I would say in terms of access to information, you can imagine, even if you're not familiar with these areas in state government, but all of the information around a child, whether it's child protection, juvenile justice, education, this is highly confidential information. We have information about the child, we have information about the child's parents, their siblings, and this is information that could be really damaging to a child as they grow. It's just not information that you need everyone to know about. So having someone who can be trusted, someone who is impartial, who can access the information, who is not only a voice for children, but is a set of eyes for the rest of the public. And then our statute allows us to share information if if within the team of an individual child, if it's relevant to that child's success, we can share that information. We can also share information publicly when it's in the interest of the public, when it's in the interest of other children. So here's a set of trusted eyes that's looking at what's going on in the system and can bring that to light so that we can inform policy, so that we can educate the communities, so that we can help adjust what happens at schools and elsewhere, healthcare in particular as well. So it's just doing that without violating a whole lot of confidentialities and making sure things are safe, but also having that mandate to share information in a safe way so that folks can be informed about that. Question?
You keep saying how large is your team?
It's enormous. So we've been, for the past 2 years, we're 3 people. And I think we've been pretty productive. We've had the help of a little army of interns here and there. And we are just now hiring 2.5 more people. So it seems as though our performance so far has impressed the legislature enough and the governor that they have passed and supported a budget increase for the office that's doubled, and our staffing is doubling as well. And we'll still certainly rely upon interns. And those of you who work with young people in schools, it's a wonderful opportunity for folks who are interested in policy to come in and learn, at the ground level what goes on with children, and at the top level how policy is developed and promoted. So it's a great opportunity. But we are very small. I think that the range of size of offices like ours across the country is from 1 to about, I think Massachusetts has 14 people now. Many of the offices, like Massachusetts, rely upon grants as well, where they take on broader obligations that come with them, funding streams as well. And so Massachusetts, where there are 14, they do have a much broader mandate jurisdiction than our office does. But I think that coming up to 5.5 permanent positions will really be suitable for the kind of work we want to do in Manchester, in New Hampshire. We certainly partner a lot. We collaborate with a lot of other agencies and entities, and a lot of advocates as well. So we rely a great deal on them. And we'd like to grow the advocacy community as well. We want to see more kids speaking for themselves. We want to see more parents speaking for their experience and for their kids. So that's the part of the office that is that's sort of structured around complaints or dissatisfaction with the system. The other piece of information that flows into our office regularly are the reports of incidents. So our statute requires that the department report to us all incidents of children, and we've interpreted that to mean when a child dies, when a child is injured, when a child is missing, and there's always every day a good number of children who are missing who are under the care supervision of the division. That doesn't include children who are missing that the state doesn't know about, just children who the department should know where they are. And also children who are restrained or secluded when they're in a residential program or in foster care. The law on restraints and seclusion, RSA 126U, applies equally to child welfare as it does to schools. Again, to the question about education, because we don't have access to educational records, we can't provide the oversight of children who are in residential placements and are being restrained or secluded. We couldn't intervene on behalf of those children. We could intervene as a facility-wide problem, but we wouldn't be able to access the records of those children who are placed by their school system. So we have a little over, I think, about 21 residential facilities here in New Hampshire where children are placed either by DCYF or by their schools, and we provide oversight of those placements, review the programs, review the services children are receiving, and when these reports of incidents come in, we look at those incidents. Sure, go ahead.
Do you keep track of children that are homeless, whether they're with their parents or not?
The only thing we keep track of, the information that we receive, is children who are missing, that DCYF should know where they are. So we do have a member of our staff sits on a subcommittee of around youth homelessness, and so we're monitoring the issue, but we don't keep records on all of them. But it certainly is it is a concern, and also I would suggest that there are a lot of children who are homeless who are not recognized as such. Even their schools don't know, and they call couch surfing kids, kids who are just moving around and still showing up at school every day, but not having a permanent place to live. So that is a big problem, and we know being homeless is another adverse childhood experience that's gonna impact. Even if they do well in school, they may end up with diabetes, with congestive heart failure, with all sorts of other health problems, substance use, because they didn't have that stable start as kids. It's really interesting, the research that's been done on what happens to kids as they grow older when they've had these experiences in early ages. It's stunning. The research is very good, so happy to share information about that later. So we monitor these incidents. We look at individual ones to see how we can make sure children are safe and well cared for, their needs met, and then again, all of the incident data that we receive and all of the complaints, we've put those together and monitor for trends in the system. So one of the things that we're very excited about that's very innovative for an office like ours is that we've received some support to develop a system of review of critical incidents and other problematic cases using safety science. Is anyone familiar with the concept of safety science? Okay, you're gonna love this, it's really interesting. So safety science is an evaluative science. It's a compilation of several different types of sciences, and it's something that's used in safety critical industries like the nuclear power or aviation and more in healthcare. And the crux of safety science is that you promote honesty and really careful diving into human error in a safe environment where people can talk about it. And one of the examples I like to give is a study that was done around the Boston area, probably a little more than a decade ago, where they saw that when surgeons were honest with people and told them that they made mistakes, they had fewer lawsuits. So people are able to, you create an environment where people can talk about how the system is functioning, that human error or just certain decisions were made very openly, and then you can figure out where the weaknesses are in the system, and you can repair those. So we have a little system that was created called System Learning Reviews. We've done 7 of them at this point. One of them was a cross-border one with Maine, which was very interesting, looking at 2 systems colliding. And what we do is we use a case as an exemplar. We bring in the experts who work on those cases. So we bring in caseworkers from the field. We bring in juvenile probation and parole officers from the field. We bring in supervisors. We bring in administrators from DCYF. These are all folks with expertise, but they haven't worked on this particular case. We just want to understand how the system functions, but we don't want to have someone sitting there saying, why did you do this? Why did you do that? Instead, we look at several factors that influence decisions in the course of the state service. So what were competing needs that a caseworker might have felt? What were some of the pressures, oftentimes timelines, oftentimes workload? What's the sort of local rationality? What do people typically do? And a great example came out of Tennessee, because this work in child welfare came from Tennessee, was where there was a critical incident involving a child who lived in a very rural area of Tennessee, and the caseworker didn't make the visit to see that child the day before to possibly avert this terrible tragedy. So what they found was the family typically didn't engage with the agency, so if you went out there, they probably wouldn't talk to you. There was a very bad storm impending. The home was at the end of a rural road that was almost not even a road most often. It was really bad shape. And caseworkers didn't have vehicles with 4-wheel drive. And so the solution, or the remedy that came out of looking at that case, was that caseworkers in Tennessee in those rural areas now get 4-wheel drive vehicles. So you're looking for what are some of the systemic solutions that we can make that make it easier for people to be available to do their job consequences that may impact decision-making in cases. Because every decision is the right decision, because it's the decision that you made with what you had available. So we're not going to fire people to solve problems. First of all, in New Hampshire, I don't know if you noticed, but there's a really low unemployment rate, so we can't keep firing people, so we can't replace them. And those of you who are managers have to deal with that every day. So how can we better situate our environment for people to work in so that they have the resources that they need? So some of the results from our work so far has been being able to support legislation that increased staffing for CYF. And we're hoping in the coming year, as those staff get up and running, that we're going to see a more responsive workforce. The number one complaint we get is people don't return calls. We're hoping those calls are going to be returned because there's more people with more time to do it. They also added aides so that there could be someone who could assist a caseworker to return calls. We're seeing an expansion of services. No matter what a great caseworker you might be, if you don't have services to refer a child to, that is just not going to be able to solve the child's deepest, root of the problem. So we're hoping to see Senate Bill 14 really expanded community-based services, and we'll see more of that. And that all of our evaluative work that we did, where we brought people in to talk about it, informed us of those things about the system. And that experience of that system learning review is also practice enhancing. People for the first time were able to sit down and evaluate how their system supported their work and be heard. And that was really powerful. The response we get from folks is that, it's the first time anybody wanted my opinion. It's the first time anybody actually described what my job looks like, and really feeling empowered and thinking through and going back to work, feeling that sense that there's ways to solve problems with their work. So that's been a really positive experience. That's sort of basically how we operate in terms of collecting information, reviewing things. We do other reviews. We do issue briefings if there's an issue that's popping up. We saw a lot of disconnect between the Department of Corrections and the Department of Health and Human Services, or the Division of Children, Youth, and Families, in that the law requires certain things when a child is out of their home. They have to be reunified or at least in a permanent home within a year. But in order to do that, you have to have visits with the parents. The parents have rights. If the parents don't show up at court, then you can't terminate their rights until you go through that whole process. And the child's laying there, and it turns out the parent is off in the custody of the Department of Corrections, and no one's talking about where are they, can we do visits, how does it happen? And when you show up to do visits, you don't have the right outfit on, or you haven't signed the right piece of paper, and this child has gone through this whole emotional turmoil of getting there, and there's no visit. So we were able to help the Department of Corrections and Health and Human Services smooth some of those things out from the findings that we made, talking to parents and talking to kids. So that's we're in that sort of role of a conduit of facilitating a little smoother working of state government. So it's great to be a part of that. How about questions at this point? Go ahead.
So I'm a CASA.
Thank you.
And you talk about reunification within a year. The case is 4 years old now. And the child's up for adoption. But I still am not seeing, there's still incredible turnover and no continuity in CYF at all. And I'm wondering if you have any thoughts about that or how that might be fixed. And I know that the social workers are they face incredible caseloads. It's ridiculous. And I did actually have a recent social worker who finally called me back. But the ones previous to that, they would never call me back. So I don't know if you have any thoughts about how to help this family with CYF, because it is still.
Yeah, thank you for that question. And it is really important for us to always acknowledge the reality of the situation. There are no quick fixes. We need the system to be held accountable, which we're doing with our kinds of reviews. But also, nothing changes like that. So first of all, the hiring process was very slow. And we were very critical about that until we tried to hire people, and it took us months and months just to get a job description approved. So the bureaucracy rumbles in those areas. And then once you start hiring people, they're in training for a lengthy period of time. So we actually saw a couple of offices district offices of DCYF to start to crumble all over again because, it looked like help was here, but then help wasn't here. So that's going to take some time. I think there's also some cultural aspect. We get used to a way of doing work, right? I mean, we get used to being overloaded. And when we're overloaded, we start to step over things. These are, in safety science, we call those workarounds. We start becoming immune to some of the weaknesses of the system. So not only do we need more people, we have to uptrain and we have to raise awareness to the higher standard of how they're supposed to perform. So it's not going to happen overnight. At the same time, we have to be able to talk positively about this change and encourage people to think that this is an agency that's in transformation and would be an exciting place to work. Because what we found is that the same thing happened in Maine. They had a couple of tragic deaths right after New Hampshire did. And they have gone through a whole transformation, and they have approved funding for hiring a whole bunch more caseworkers. Massachusetts is hiring more. Vermont, Massachusetts, and Maine all pay substantially more to their caseworkers than New Hampshire does. So how do we attract people to work in these positions when it is so hard? And I'd like to think that people are attracted to these positions when they see a system that's in transformation and is committed to doing a better job. And so we have to support that, but also honor the need for this independent oversight that's going to point out where it's not working and how you push it forward. So I would say be patient, but don't tolerate a service that's not adequate. Always, and we tell everyone who calls our office, call that caseworker, call the caseworker supervisor, call the field administrator, call the central office, because the communication has to happen, particularly with CASA. Does everyone in here know what CASA is, the Court Appointed Special Advocate? So a really important role. New Hampshire probably has one of the best programs in terms of education and support for those people who represent children's interests in the courts, and that's all they have. In many states, children have lawyers who represent them and their interests. In some states, they have lawyers who represent their interests and lawyers who represent their voiced interests. So there's lots of resources for kids. In New Hampshire, we rely upon the CASAs, but they do a really good job, so much so that our staff participate in their training as well, because it's a great training. But that's an important role, and it's part of the team. So every child in the system has that team, whether it's their school, their CASA, their lawyer, the DCYF caseworker, all of those people. It always comes back to the number one finding that we make in all of our reviews is the need for communication, and as important, understanding the role of every person. So when we did our big reviews, particularly those around child deaths, we saw a pretty significant disconnect, depending on the district, between the child welfare system and law enforcement. What do we understand about each other's roles? At the hospitals, when we looked at the experience of children who are born exposed to substances, what do the hospitals understand about their obligations under federal and state law? And what do the hospitals understand about the role of the DCYF caseworker? And how does the caseworker understand the hospitals are where they get the information they need? Because ultimately, we all want the child to go home from the hospital safe, with lots of support for the mother, whether it's recovery support, housing support, income support, and most importantly, long-term early supports and services, early intervention, developmental services for that child who was born with an exposure to a substance that's going to impact his or her development over time. Maybe not today, but certainly in the next couple of years, something that needs to go on. So that's a whole team approach and really necessary. That people are talking, so returning calls, really, really important. Any other questions? Sure.
Recommending increasing staff. What kind of methodology or criteria do you use to come to that conclusion? How do you develop the data determination?
Yeah, that's also a good question, because oftentimes what you hear people say is the national standard for an assessment caseworker is 12 cases per caseworker. And we're running right now around 40. So then you ask the questions, well, how how does that translate for rural New Hampshire or urban New Hampshire, or the acuity of those cases, or how many kids are in those cases, because cases just is a family. There may be 3 or 4 kids in that family. Each one of them has their own individual needs. So it really is trying to find some sort of a balance, because there's not a lot of research around that 12 case standard. Other than that, a lot of people support it, and in some jurisdictions it seems to be working. And then the other reality is, what are the resources available in this particular state? We have very limited revenue, so what can we afford? I would argue that we can't afford to let children out there without support, because that becomes a cost to the state for the trajectory of that child's life. So it's important to really beef up those services where we need them. So you sort of aim for the standard, and you find what's tolerable in the workforce, and then you've got to be measuring your outcomes for the children. So over time, you're looking at like the 12-month permanency. Are you getting all your children where they need to be within 12 months? Are they in a stable home? If they're not, then we use the system learning review might show us where are the weaknesses. Is it the workload alone, or is it the workload and something else, or is it these other things where you might be able to manage it with the workload? So over time, we are going to be able to generate that kind of data that will give us a little bit more information, and it may end up being specific to district offices, because you know that the Southern District, which includes Nashua, is very different from the districts up around the mountain area, where people are driving all day long to get to one child. So you can't have the same workload if it's going to take you 2 hours to get to one child. So we may see that we have to make adjustments here and there too. But that's an important question. It's a challenge for managers to figure out what the right number is. Other questions? Sure.
Is your office looking into resources for suicide prevention for adolescents in particular?
Yeah, that's a great question, because suicide really is, it's a rising problem among several age levels, but certainly with adolescents. We have seen a couple of suicides more recently here in Concord, unfortunately. So we look at all deaths that have a DCYF involvement. So DCYF has to report us about any death where the child had an open case or recently had a case. DCYF also now will review deaths of children where that have no DCYF involvement, but there's unexplainable events that caused the death. So in case if it was a death that was caused by abuse or neglect, DCYF will do a review. And so we get reported about those. We don't get reports on all child deaths, so we do miss a number of those suicide deaths. However, we are a member of the newly established State Child Fatality Review Committee. There's always been a Child Fatality Review Committee, but this one was codified this past year in statute. There are about 30 members of that committee, and they'll be looking at all child deaths. There's also a suicide fatality review committee that looks specifically at that. But we certainly are paying attention to that, and we'll work actually regionally. We're talking to other states about it being a problem here. And the goal in that would be to understand, again, what are the influences that cause a child that level of despair, and what sort of supports could we institute that would help kids not take those actions.
It just seems like there's not enough resources, especially for that age group.
Right, and I think that, first of all, it's recognizing it goes back to schools. What are schools seeing every day, and how are schools educated? There was a great gathering here in Concord last year of kids from all over the state to talk about mental health with Judge Broderick. And they had a whole working session on that, on suicide. And what the kids proposed, their recommendations were more education for teachers to recognize suicide, more guidance counselors in the school so kids have people to talk to. And I would say, again, Senate Bill 14, which is establishing community-based services for kids, which is creating rapid response, mobile response to crises, to family-defined crises, so that maybe we is a community answer to those sorts of things, because we are seeing a lot of children who are not engaged. So when we talk about adverse childhood experiences, there are a couple of things that help children be resilient, no matter what happens to them. One of them we've always known is a consistent caring adult, one person who shows an interest in that child. But also that it's so important, the sense of belonging in a community, feeling as though you belong. And what does that look like? You know, that when you go to the store, someone says hello to you, someone asks you how school is going, someone supports you in a sporting event, and just feeling part of the community. And I think that's where you're seeing a lot of the breakdown, because a child may have mental illness and not have a connection to seek help, or a child may not have mental illness but just may not be connected and feel despair. So those are things that we need to build as a system, but also as a community.
Moira, can I
Sure.
add to that? So my name is Deli Champagne. I work for the Children's Behavioral Health Collaborative, and I'm not sure if you're aware, but we had a bill passed last year that said all faculty in a school will now have to have 2 hours of suicide prevention training, and that goes into effect July 1st. So a lot of districts are really ramping up to get that work done. We also have a suicide prevention council that is mandated by the state. We meet once a month, and we're doing a lot of great things to bring awareness to suicide prevention and hopefully some prevention strategies. And then probably the biggest thing that all of you in the room can do is support a couple of bills that are in the legislature right now, asking the state to expand multi-tiered systems of support for behavioral health and wellness in our schools. The acronym is MTSSB. You may have heard of it. That's going to create a framework within all of our schools to elevate social emotional learning. Right now, academic learning is here, social emotional is here. We know if we switch that, our test scores are going to go up if kids come to school ready to learn. We don't have that thinking yet in New Hampshire. We need a huge paradigm shift, or some people don't have that thinking. Very, very frustrating. See me after. I'll give you my card and I'll tell you what bills need your support to really expand the system in New Hampshire to promote social emotional learning.
Great, thank you, Tom. That's great. And there's always opportunities if you get on the mailing list of the Children's Behavioral Health Collaborative. You can find out what policies they're promoting and opportunities to go and do advocacy work. So we've got a few minutes left. I just to see about connections in the room. So I know we have Children's Behavioral Health, we have CASA, we have education. What are some of the other areas that you folks represent in terms of being part of the system here in New Hampshire? Would you mind sharing with me?
I'm the welfare administrator.
Yeah.
I'll be
What's that?
legislative budget assistant.
Oh, okay, oh, great. So you're the money guy, you know how it works. Same, yeah. And you say where you're from?
I'm a journalist.
You're, oh, great.
Actually, also a doctor of parents at BCYF and a former Catholic.
Perfect, thank you for that. And journalism is really important. In fact, it's really interesting when people say, like, how do I become a child advocate or an ombudsman? There's probably the most represented profession in ombudsman work is journalists, you know, because it is a process of investigating and doing a lot of writing. And I always encourage journalists to apply for these jobs. And then on the other side, and the one piece I didn't mention about our role, so we get this information, we investigate, we advocate on behalf of kids. We also write a lot of reports, and we're required by our mandate to do outreach and education. And we use the office as a platform to inform the community, because that will inform policy, it will engage people, it will help children. So journalists are a really important partner to us because we need them to be interested in the work we're doing and to disseminate that, get people engaged. And so that's a really important piece. Some people sometimes aren't comfortable with that because, you know, just exposing weaknesses in a system are not always welcome. It's hard to have someone overseeing your work. But I think for the most part, we've been able to engage a really broad community because of the help of the work journalists have done.
I'll test your support for journalists. A lot of New Hampshire system is a closed loop. It's all confidential. There are states that what part would opening up part of this system, like courts, I used to represent cases court without closed session. What do you think that would add to what you do?
Sure, that's a great question. And I think I sort of addressed it early on when I talked about the importance of confidentiality, particularly with kids. And so take for example the death of a child. We try not to use names of kids when we use our authority. We have authority to see this information. We have authority to share the information. But we're always mindful that every piece of information that we make public is going to affect a survivor. Right? There's always more family, and so if someone is killed by their parent, it's a terrible situation. There's maybe a surviving sibling that wasn't killed, but still has to live with that scenario. People are going to wonder about what's going on. So it is really we have to tread carefully about that. I think opening up children's cases, particularly in child protection, you're wondering, are you protecting the parent offender or are you protecting the child? And at this point, I feel like the Office of the Child Advocate could serve as those eyes to look at it and make sure that the system is working properly, and then share information when it's not. So it requires a great deal of trust, which is why it's so important for our office to be independent, and that's also been challenged, our independence, because we can't be part of the system, we can't be politically connected, we can't have any of those connections that would impact our impartiality and ability to be able to look at something and report it as it is. So while journalists are really important, we would hope that they would value the information and trust the information that comes out of our office, which is a big ask. It's a big ask to trust someone who also works in state government. But that's why we protect the idea of independence so carefully.
I worked for the court system for 7 years, and one of the reasons why we want that protection is because of children's suicide. Like you mentioned, we don't want a sibling to be in such distress seeing all of this, whether it be on the TV or people approaching them or in the newspapers. It's hard enough for them to deal with what's going on within their family rather than seeing it in a mass.
And one of the things that we're grappling with, and I would really be happy if we could figure it out, is how to promote the value of children in general. And you definitely see this in juvenile justice cases, but you also see it in child protection cases. No matter how badly a child has been treated, the children are perpetually blamed for their parents' mistakes. The children are often blamed for their parents' behaviors. Parents with substance use issues, children are blamed for that. And the way that we treat them, the way that we value them, the way that we put them on the agenda and invest in them often reflects that. We see kids who are involved in the juvenile justice system who are acutely mentally ill, but because they also have behaviors that have been criminal, they're not welcome in hospitals. They're not offered services that other kids would be offered, because we're able to put them in a box that says that this is a bad kid essentially. And so we have to find a way to expose the system operation without exposing the individual child, because we do absolutely hold those kids accountable. I don't know why, but all of the records that we read, all of the kids that we meet, all of the staff that we talk to, you always say, well, that child made the decision to do that. And quite frankly, that child has no capacity to make such decisions. The child is just doing what they've either learned, how they survive, but no one's ever told them otherwise, or just, they have an imbalanced chemistry or a damaged brain because of what they've experienced. So it is really complicated, and you don't want to be another part of a closed system, so you find a way to open it as best you can, while still protecting that individual child and promoting the value of that child. Sure.
I think with reviewing any system, you kind of see what's priority, what's high priority, low priority, what's kind of easy fix, and what's hard, what's a difficult fix, or a really heavy lift. Have you come across that, reviewing the systems, and what's kind of the heaviest lift?
Sure. I mean, we just did a big, and Emily was the author and investigator in a huge review about children who are born substance exposed. And it was very clear in the past 10, 15 years, the advancements in science around brain development have been off the charts. I mean, it's so interesting. You can look at MRIs of a healthy brain and what it looks like after it's been exposed to some toxic substance or some toxic activity, domestic violence, whatever. You actually see brains like just erode. So we know what works. So in that study we found, and we heard a pediatrician say, that early supports and services, getting in really early and helping that child is going to put that child on a healthier path. And that because of that exposure early on, we can't assume that because we've gotten the family stabilized or because we've got the child to a stable adoptive home that everything's going to be okay, because we're going to see the developmental impact later. So we've really learned a lot about what happens early on and what we could do. If we invest a whole lot at the beginning, then we're going to get a healthier kid who's better able to function and who may actually resolve all of those developmental insults. So the heartbreaking thing for me is to open up a case of an 18 or someone who's about to be 18 years old who at birth or at age 1 or at age 2 came known to the system, had parents who were mentally ill, had parents who were using substances, had exposures to terrible violences, had loads of, and we didn't do anything then. And now, because that child never had their needs met, they have developed behaviors. So behavior is a form of communication, right? When I behave a certain way, it means something. If I smile, that means that I'm open to you and I want to establish a relationship. If I hit you, if I drink, if I steal something, that's telling you that there's a purpose, there's a function to all of our behaviors. So when those kids don't get their needs met early, they develop these really annoying behaviors, very hard to keep them sitting still at school, very hard to tolerate their criminal behaviors, and so we resent them for that, we hold them accountable for that, and now they're in the system, they're gonna leave the Sununu Youth Services Center, they're not gonna have the services they need at age 18, they're gonna be in corrections for who knows how long. So to me, that's a bad investment. That's a long-term bad investment. If we would focus on kids early on, and they may not be babies, they may come into the system a little bit later when their families are having a hard time. Really focus on those developmental needs then. And it may take some extra money. We certainly don't have enough behavioral psychologists in this state. No one's looking at how do you help a child communicate in pro-social ways. Invest there, you'll save money later on. I don't know what it costs in corrections, $60,000 a year. So it's not as much as it costs for a child to be at the Sununu Center. But that's a permanent investment in those kids unless they leave the state. So I don't see how it's not a good investment to take action very early and make sure that we understand, number one, that child, because even with Senate Bill 14, those are community mental health services. A lot of the problems are not mental health. A lot of the problems are behavior and communication disorders. Even children with autism, when they haven't gotten the help they need and they turn 12, they're frustrated because they can't communicate. People don't understand them. It's very possible that they can become assaultive. And now what are we going to do with them? Now we're going to blame them because they're misbehaving. So I think that the investments we really need to look at, and the state has been somewhat responsive to that. We are investing in early supports and services. We're investing in allowing parents not to have to repay for those services as they have traditionally. That may cost the state a little bit, although apparently it actually costs more to have the staff to go after parents to pay for those things. So it balances out. So making sure we have those services early and we respond to kids, then I think you will see substantial savings. In New Jersey, when they established their system of care, which we're expanding now with Senate Bill 14, and they had rapid mobile response to families, they had lots of support for families in the community. They actually closed their state psychiatric facility for children. They closed a number of residential placements, which are very expensive, and children are being treated and cared for in schools. multi-systemic therapy in Kentucky and similar conditions to New Hampshire. 3 months of multi-systemic therapy, which is intensive 24/7 professional master's level psychologist supporting the family, learning how to manage crises, learning how to manage behaviors. That lasts, the average length of service is 3 to 4 months at a cost of about $11,000. It's now about $1 million a year to have a child at this Community Services Center. So, I mean, that to me, I'm not very good at math, but that makes sense to me to look at those intensive services that have evidence that they work. That's the other thing. You know, sometimes we do things that this is how we've always done it, but there's actually good science of what programs are effective now. And I think that the department is moving towards contracting for, they have a whole system redesign plan. They're going to be contracting for services so we can hold services accountable, and they can demand evidence-based programs that are going to work. So I think those are the investments that may seem a little bit expensive up front, but you're going to see much shorter length of stay and much better trajectories of kids in the future. So,
Well, I will say in the 2 years that I've been in my job and working with the legislature, you have to show savings. You have to show a connection to the dollar amount. So trying to pass Senate Bill 14, which is the biggest provision is mobile crisis within an hour for every child in the state. The goal is to have 10 mobile crisis units statewide. We were in the Senate listening to their discussion about it, and one of the senators raised his hand and said, well, how much is this going to cost us? Mm-hmm. That $9 million price tag seems like such a lot of money. And you probably know who I just and Senator Bradley said, currently we have a $7 million lawsuit against the state, and mobile crisis could have taken care of that, and that's just one lawsuit. So that was able to pass 24-0 because we were able to show the dollar amount savings. So that's how still a lot of our legislators think. It's not what's in the best interest of the child and the family. It's how am I going to save the taxpayer money? I hate to say it, but that's still a philosophy in New Hampshire that's very strong.
Mm-hmm. Yeah. So we're I finished with looking forward for the Office of the Child Advocate with our new staff. We're actually hiring a data analyst, someone who can really dig into both the data, the children's data, but also some financial data to understand what works. There's a process that's been used quite a bit around the world. It's not being used a lot yet in the United States, but we're looking at child impact studies. So looking at public policy and how it will affect children and what the cost will be and the cost savings. So that's going to be a priority of the Office of the Child going forward, is to be able to inform the legislature and the governor on what programs are being helpful for kids, what they're costing, and where we can make some good investments for them. So that's sort of, in a nutshell, the Office of the Child Advocate. We respond when children call us or people call us about children, try to help them individually as best we can. Sometimes we just can't because the system won't bear it, but then taking that information and trying to really influence how the system's operating so it's more responsive to kids. And I should throw in there that by statute and in actuality, the Department of Health and Human Services does have an ombudsman. It has an internal ombudsman, and that's where complaints should go first, because internally they can try to fix their own issues, and they also have more staff than we do. I would always advise that you use the ombudsman as you can with any issues with Department of Health and Human Services. So
can I put in a plug for something? So a few months ago, Moira introduced me to Christina Toth. She runs the Family Connection Center at the Department of Corrections. And we started a film series together. The film is called Trey Mason Day Song. 15,000 children in the state of New Hampshire have an incarcerated parent, and they're in our schools. That's about one kid in every classroom. And teachers don't even realize it, so they don't know how to help these kids. So we've started this film series. We have shown it twice already. We have 8 more lined up for this spring. We have panels at every series of children who have an incarcerated parent. We also have an incarcerated gentleman that's been sitting on the panel. And we're talking about the need to support these kids. For example, one of the girls on the panel last week was a student at Plymouth State University. That's where we were. She said to her classmates, "Did you know I have a dad in prison?" And they all just And she said, yeah, because you wouldn't know it by looking at me or whatever. But she talked about, we asked, what is it that helped you get to college? Because your trajectory probably wouldn't have showed that on paper. And she said, my kindergarten teacher. When my dad went into prison, she wrapped her arms around me and gave me the foundation and the start that I needed to still feel good about myself. But anyway, so I would love for you to go on our website and see when the next screenings are. We have one in Rochester the 21st, March 3rd in Berlin. We have one in Manchester, Nashua. So love to have you, and then, have you come and support legislation around that to increase programs for these kids. So
I went to the one here in Concord, and it was fabulous. I just can't even say enough about how good that program was.
well, that's all because of Moira introducing me and Christina. So that was a great partnership. I thank you so much for that.
Thank you for that, Dilly, and I think that's really an important role of the Office of the Child Advocate, as because we have access to information, we hear about things we encounter. So many people who are doing remarkable things on behalf of children in the state, but they aren't all connected. So being able to share information to bring together a team around an individual child, but at the same time sharing information and bringing together teams across the state who are doing really good work for kids is going to make all of that work more powerful. The film series is really powerful. They're very well done films, and it's really important people go and see them because, again, if your parent is in prison, that you're implicated by that. And it's really an opportunity to sit and think about the kids in our neighborhood. So I finished with asking you, if you pass by a kid today, say hello to that kid. And just ask them how their day is, because it will surprise them, but they'll feel good about it. So thank you so much for listening and for your questions. It's been great talking with you.
Thank you.